So the link between a lip tie and spacing or gapping between your front teeth. So there are four types of lip ties or lip attachments, if you will. Grade 1 is actually considered normal, so it's when the lip attachment is high up under the gum. A grade 2 is kind of mid upper gum area. A grade 3 is when it attaches right between the front teeth, but it's not wrapping around the front teeth. And then a grade 4 is the one that wraps all the way around in between the front teeth. So that piece of tissue will cause a physical barrier, if it's a grade 3 or 4, to those teeth coming together. Why is that a big deal? Well, it's harder to keep those front teeth clean with a grade 3 or 4 because it holds the lip down pretty tightly. It can also traumatize the tissue if you brush straight across those two front teeth and hit that tissue every time. So on a young kid, you'll notice that they really don't like when you brush those top front teeth. And if we don't brush them adequately, then there is going to be an increased risk for causing cavities or cavities being created in that area. So lip tie doesn't cause cavities, but if it's more difficult to brush up there, then we're going to have more plaque and potential for cavities in those areas. What we do know is that removing those lip ties can help those teeth come together and give the lip better mobility for easier brushing. And there used to be a way of thinking that if we removed a lip tie before braces, then we'd cause scar tissue and the teeth would never come together. Those procedures were really done very aggressively, usually with a scalpel. Now with laser technology, because there is really minimal to no scar tissue formation, we actually see teeth spontaneously come together when we do these lip tie releases. So, sometimes we do them at a young age, depending on, if it's a grade 3 or 4, because those don't move at all. But what we do know is one that is not wrapping all the way between the teeth can actually migrate up till about age 4. There's a research paper on that. So we don't always jump to do them at a super young age, but if at age 4 there's gapping, we know that's not going to fix itself.